Today, we're going to step into the world of a real medical investigation. This is a story where a single signal on a lab test kicks off a high-stakes search for answers. And it's not just about finding a diagnosis, it's really about the art of making a huge decision when the path forward is anything but clear.
So let's set the scene. Our story centers on a patient who had a successful surgery back in 2021 and was in complete remission. For years, everything looked great. All the tests were normal, no symptoms, just quiet. Then, in 2025, a routine test suddenly flags something. A key chemical marker, one that's linked to the original tumor, has popped back up.
Now, to really get why this is such a big deal, you need to understand the culprit we're talking about, a paraganglioma. The best way to think of this rare tumor is like a rogue factory inside the body. And it's a factory that can just flood your system with these incredibly powerful fight-or-flight hormones called catecholamines. If that factory goes haywire, it can trigger a major crisis. So yeah, any sign of its return, you take that very, very seriously.
And here it is. This is the first clue. The signal was a threefold increase in something called plasma metanephrines. Honestly, you can just think of these as the chemical fingerprints that the tumor leaves behind in the bloodstream. A jump this big isn't just a blip. It's a loud and clear sign that something's up, and it's the very first thread our medical detectives have to pull on.
So, with that first clue in hand, the investigation officially begins. The mission now is to follow this biochemical trail and figure out, is this threat for real? If it is, where is it hiding? And what exactly is it doing? And that's such a crucial question, right? A single lab test is just a starting point. It raises a huge question, but it doesn't give you the whole answer. So how do you go from a number on a piece of paper to an actual concrete plan?
Well, you do it methodically. There's a playbook for this. First things first, you confirm the clue. You repeat the tests to make absolutely sure it wasn't just a one-time fluke. Once you know the signal is real and consistent, then the hunt for the source begins. And for that, you use advanced imaging. These are special scans designed to light up these very specific tumor cells. Finally, you have to assess the overall risk, which can even mean doing genetic testing to see if there are mutations that point to a more aggressive kind of tumor.
And the investigation pays off, big time. An MRI spots a little nodule on the adrenal gland, and the report says it's lipid poor, which basically means it's not made of normal fat tissue, a huge red flag. Then comes the clincher, a highly specific DOTATATE PET scan. The nodule is avid. It lights up like a Christmas tree on the scan. That's the smoking gun. They've found the source, and it has the exact same characteristics as the original tumor.
So, the case is pretty much cracked. All the evidence points in one direction. The patient has a new, small tumor that is actively pumping out those hormones we talked about. That signal wasn't a ghost. It was a beacon, and it led them right to the source. But you know, finding the tumor is only half the battle. Now comes the really hard part, deciding what to do about it. And this brings us to the absolute core of our story, this critical choice between immediate action and strategic patience.
You see, the guiding philosophy for the medical team here is so important. The temptation might be to just rush back into surgery, right? To just cut the thing out. But the much wiser approach, the one they're following, is guided by physiology. It's about understanding what the tumor is actually doing to the body, not just reacting to the fact that it's there.
And that philosophy translates into this really careful balancing act. On one hand, just observing might be the right call if the hormone levels are stable and the tumor isn't growing. But on the other hand, surgery starts to look like the right path if those hormone levels are climbing, if the tumor itself is getting bigger, or if it's what's called FDG-Avid, which is just a fancy way of saying it's gobbling up a lot of sugar, a sign it might be growing. And of course, the patient's own genetic risk and what they prefer, that all plays a massive role too.
So, in this particular case, after weighing all the evidence, the team and the patient together decide that surgery is the right way to go. The signal is clear, the source has been located, and the risks of waiting just seem to outweigh the benefits.
But you don't just book an operating room. No. With a hormonally active tumor like this, the preparation is every bit as critical as the surgery itself. The goal here is basically to disarm the target before the mission even begins. And here's exactly why that prep is so vital. During the surgery, the tumor can get bumped or moved around, causing it to just dump a massive amount of those powerful hormones into the bloodstream all at once. It's called a catecholamine surge, and it can cause a catastrophic spike in blood pressure and heart rate. It is a true life-threatening emergency.
And this is the really key point.
Even though our patient has totally normal blood pressure in their day-to-day life, that tumor is biochemically active. The risk isn't about their current health state, it's about what could happen under the stress of an operation. That potential danger absolutely has to be neutralized before they ever go into the OR.
So, the safety protocol is this incredibly precise three-step process. First, they use medications called alpha-blockers to stop the hormones from clamping down on the blood vessels. Only then do they add beta-blockers to control the heart rate. Doing it in the wrong order is actually dangerous. And finally, they have the patient increase their salt and fluid intake to expand their blood volume, which creates this crucial safety buffer in the whole system.
And listen, this is not a quick fix. This whole disarmament process takes time. We're talking a minimum of 10 to 14 days to slowly and safely get the body ready and bring the risk of that dangerous hormonal surge way, way down. You just can't rush safety.
And all of this entire process, leads us to the central lesson of this case, what you could call the art of waiting. It's this deep understanding that sometimes the most important decision isn't what you do, but when you do it.
So what are the big takeaways from this whole medical detective story? I think it boils down to this. First, a biochemical signal is a clue. It's not a command to act. Second, meticulous preparation isn't just a good idea, it's the absolute key to safety. And finally, a thoughtful, physiology-guided approach will always beat a knee-jerk reaction.
And that really leaves us with a final question to think about, one that extends way beyond the walls of a hospital. In a world that so often prizes immediate, decisive action, what is the real value of a deliberate, well-timed pause?